Did you know that 1 out of every 10 babies is born prematurely? Those fragile infants miss out on vital growth and nutrition that can put them at risk. And joining us with important information on how to help those newborns survive and thrive is neonatologist Dr. Melinda Elliott. Welcome.
Hi, and thanks for having me.
Doctor, babies need a full term in the womb to grow. How can premature birth adversely affect a baby's health?
If you're born very prematurely, that is before 29 weeks gestation or 3 months or more early, then you're at risk for long-term problems with a baby's lungs, with a baby's brain, with a baby's intestines, and maybe even the development of cerebral palsy, asthma, neurodevelopmental delay. All kinds of complications can occur to these infants born this early.
And proper nutrition is imperative from day one.
If we don't give these babies the amount of protein they need, as well as the calories they need, they're not going to grow and thrive. Full-term babies need mother's milk. They only need probably about 100 calories per kilo per day. Little babies need up to 40% more than that to grow and develop, and they need more than twice as much protein as a full-term baby. Many moms think that their milk alone is all the baby needs, but when you're born extremely prematurely, you must add higher amounts of protein, calcium, calories to help the baby grow big and strong. Mom can't add that much protein to her milk. It doesn't matter what she eats. It doesn't matter what she does. She just can't make that high of a protein in her milk. So fortification is important.
There are 2 types of fortifiers, but they don't necessarily deliver the same benefits. Tell us about them.
One is made from a cow's milk product, and the other is made from donated human breast milk. Cow's milk products are associated with higher incidence of very severe intestinal problems, such as necrotizing enterocolitis, whereas the human milk-based fortifiers are actually associated with a lower incidence of necrotizing enterocolitis, a lower incidence of other long-term problems, such as sepsis, and perhaps even a shorter stay in the hospital for these very tiny babies. Prolactis is the first company and currently only company to produce human milk-based fortifiers here in the United States. They are made of very high quality products. We screen our donors very much with both blood screening and test taking. Then we screen the milk itself.
Now, what makes Prolactis fortifiers so effective?
Prolactis fortifiers are the closest fortifier to mother's own milk. We use gentle pasteurization to make it safe from infectious diseases, and we tested thoroughly. Prolactis fortifiers have been fed to over 70,000 very low birth weight infants worldwide, and they've done very well.
Now, are some women at higher risk for premature birth?
Yes, unfortunately, some are. Teenagers and older moms, those who are called advanced maternal age, over the age of somewhere around 30 to 35, those women are at higher risk for premature birth. However, it can happen to anyone. It can happen if you have high blood pressure. It can happen if you have diabetes. It can happen if you're completely healthy.
And what about steps that expectant mothers can take to reduce their risk?
First of all, take care of yourself. Do what your doctor says and get good prenatal care. If you don't have access to prenatal care, call your local health department and find out where you can get access to prenatal care, because we know good prenatal care helps to decrease prematurity.
For those parents who are currently expecting, there are resources out there to help. Where can they start?
Start at prolactis.com. It's a great resource where you can find some information about what to expect in the NICU should you find yourself there, as well as a link to a free app called Peekaboo ICU, which I love. If you do find yourself in the NICU with your baby, check out that app. It's a great way to chronicle the baby's journey through the NICU, as well as to give you a whole lot of information about everything that's going on there.
For free tips and advice on what to expect in the NICU, visit prolacta.com. Dr. Elliott, we thank you so much for sharing this valuable information and insight.
Thank you for having me.
And we thank you for joining us in San Diego Living. We'll see you next time.